Hi, Assalamu alaikum and good morning everyone. Thank you for visiting my channel again. Abdur Rahim here with you. So before starting and going towards the imaging, I would just like to thank you that you guys are watching the videos. Even though the subscribers are still in small numbers, but whoever is watching, they are really giving their response. So I like it. And the thing is most of you guys who are saying that I should be making videos in two languages, one for especially for our Asian community like Pakistan, India, Bangladesh, where I should be using Urdu or Hindi language for the videos. So at the moment I'm only doing the imaging. So let's, after the imaging, once we will start the pure echo topics theory, then I will try to make one video in two languages, okay? Or I will try to see how I can sort out this issue. So this is one thing. The other thing is that regarding the imaging, I know in the last channel, whoever was following me, we went into very much details of the imaging. Today I'll just explain you how we can get the imaging. Definitely you guys will be in the echo lab, so you will learn it from your seniors, okay? But if you have any questions after that one, or you are struggling to get any image, you can write it on the comments and I will try to help out in that one. So today I will give you a quick idea about the imaging, like how you should be doing the imaging, where your probe will be, and how you will be doing the rest of the things. So as I discussed you in the last lessons, that this is our probe, okay? This is the base of the probe, this is the tail, okay? And we use, and this mark here, sometimes you see a light here, this is called the marker of the eye. Marker of the probe or eye of the probe. So someone calls it marker, someone calls it eye. So this is very important all through the imaging. So we will start from the parasternal imaging. In parasternal imaging, we get parasternal long axis and parasternal short axis imaging, okay? What is parasternal long axis? Parasternal long axis means that you get the imaging, like you place the probe on the patient chest in a longitudinal position. For example, this is your patient lying, okay? This one is the patient's right shoulder. Like patient will be lying this way. So this will be the patient's right shoulder, and this is the chest. So you place the probe this way, like your marker should be facing towards the right shoulder of the patient, okay? And you will be getting the images like this way, okay? Like for when I will be doing my probe will be like this. Marker should be towards the right shoulder of the patient. So this is how you are going to get the parasternal long axis. In parasternal long axis, you can get two more views. One is the parasternal, one is the RV inflow view, and other one is the RV outflow view. For the RV inflow view, you just need to take your tail upwards and you will see RV inflow view. And once you take your probe downwards like this, you will see your RV outflow view. So it's a very easy one. I'll show you the views later on. I want to go quickly through the imaging because I know you guys will be practicing your own echo lab and your seniors will be with you, so you can learn it from there. So the next you will move on to your short axis imaging. By the way, in parasternal long axis, there is another image which we usually use is ascending aorta. Ascending aorta image, you just go one space up from your imaging place where you are getting. For the parasternal images, you will be doing the imaging from second to third intercostal space, okay? I think I covered everything from the parasternal long axis. Then for the short axis, your probe was here. Short axis means vertical views. So you will move your probe towards the vertical. For example, this one is the face of the patient. So this marker will go either to face or towards the left shoulder of the patient. Like your probe will be like, your marker will be at 90 degrees at 12 o'clock, okay? So this one, you will keep your probe this way to get the short axis views. In short axis, you will get different views. There are different areas, step by step. First, you will get the which is very down, which is actually very up, and your tail will be down like this to get the image, is your pulmonary valve. First of all, you will get the pulmonary valve, okay? Then you will take slightly probe up and you will see the aortic valve level. In the books, you will just see aortic valve level and you will see aortic valve in the middle, okay? And then pulmonary valve on the right side, and on the left side, tricuspid valve. But actually, pulmonary valve is situated slightly above the aortic valve, or it is slightly superior to the aortic valve. So once you are going to get the aortic valve leaflets, you are not going to get a very good pulmonic valve. So you need to take your tail slightly more downwards to get the to send your wave slightly upwards, slightly superior. You will take your tail down, so the waves will go slightly superiorly, and you will get the pulmonic valve better. So you will get the pulmonic valve, then you take your tail, you was here, your tail was like this. So you take your tail up to get the aortic valve. Once you see the aortic valve, then you take your tail up slightly, so you will see mitral valve. Then you take your tail up, you will see papillary muscles. Then you go slightly more up with your tail, and you will see the papillary muscles. So try to think about it, try to go towards the anatomy and think about it. Your pulmonic valve is most superior. Okay, so once you are going to get the pulmonic valve, your tail will be this way. Okay, so you can get the views. Then you come onto the aortic valve, so your tail will come like this. Okay, then you come onto the mitral valve, so your tail will be like this. Then you need to go further down to this level to get the pulmonic valve, so your tail will be like this. And then you need to see the apex, so your tail will be like this. In most of the patients, you don't get the apical level in the same position, so you need to go one space down from your imaging plane, so you can get the better apical imaging. Okay, so these all things, parasternal imaging, you will be doing from second to third intercostal space. By the way, again, in some patients where you need to look at the pulmonary arteries better, like for example pulmonary artery and its branches, you will go one space up, okay, from your imaging plane, like what you did for the ascending aorta. Here for the pulmonary artery, you will do the same. Go one space up, and you will see very clear pulmonary artery and its branches. Okay, so this was another trick. Let's go on to the our next window will be apical window. So in the apical window, your marker will be around 3 o'clock. Okay, so you will keep your probe like this. This is my marker here. Okay, so for example, this is the patient, so I'll keep the probe this way. Now there is a very important thing once you are doing the apical views. Apical views are easy to understand but slightly difficult to acquire. Okay, why? Because most of the people, they keep the probe this way and try to get the imaging. Okay, for example, this way. Okay, and trying to get the imaging, it means you are sending the waves to this side. Okay, what you need to do is you need to keep like a bit angulated probe. Your angle from your patient's skin towards your probe should be around 45 to 60 degrees. Okay, like this. So you are sending the waves towards the heart. What trick I usually do when I was learning is that my parasternal images are here, so my apical views should be here. So what I do is I try to keep the angle of my probe towards my long axis image, where I get the long axis image. So if you will keep that angle, you will automatically get the good images of the apical views. Always keep in your mind, like once you are getting the parasternal images, you try to get it as higher as you can. And once you are going to get the apical views, try to go as down as you can, so you will see the true apex. For the both views, parasternal imaging and apical imaging, you might get it in different places. You might get 3-4 different images, but you need to understand which one is the best image and which information you are going to get. Okay, for us, we need to get good pictures, but the most importantly, we need to acquire all the information. Okay, so try to emphasize more on information than on beautiful pictures. Okay, so this was another thing. So once you will get the first image, you angulated your probe like this. Okay, and you get the image this way, and this is your apical forechamber. Once you get the forechamber, then you will move your marker to 90 degrees. When your marker will be facing towards your left shoulder, that will be your apical 2-chamber view. So you will get apical 2-chamber view. Okay, your marker will be 12 o'clock. So if you move your marker slightly more, around 10 o'clock, okay, or 10 to 9, or maybe slightly 11 o'clock, you can say 10 to 11 o'clock, you will get your 3-chamber view. Okay, so this is how you are going to get. Okay, so this is all you can do, like 4, 3, 2. You will get these images in the apical windows. Then you go into the subcostal views. Once you come into the subcostal view, You just need to mark the xiphoid area where your sternum is, sternum bone finishes. Then you press this area, the soft area. You go into that area. Your marker is, around 3 o'clock, and you do this way. Again, the angle is very important. Okay, you need to keep this thing in your mind when you're doing the echo, whatever imaging you are doing, that your angle should be towards the heart. If I'm going to keep the probe this way, I'm not going to get the images, okay, because my heart is here and I'm sending the waves here, so I'm not going to get. So you need to keep an angle like this way to get towards the heart. Okay, so you are almost touching, like your fingers will be touching the patient's abdomen, so then you are going to get the best images for subcostal views. Once you get the subcostal view, for example the fourth chamber, then you rotate your marker slightly here. Okay, so once you will be around 12 o'clock, okay, you will see the IVC. Okay, and then once you will rotate on the same point, once you take your tail up, you will see the abdominal aorta. Once these things you will learn when you will be doing the echo. I think explaining this would be not very helpful for you, but if you are doing it and you are still struggling to get any of these, for example abdominal aorta or these things, let me know, so I'll give you more tricks on the patient. Okay, so the next thing is the suprasternal window. You will go into the suprasternal notch, okay, and this marker should be to upside. Okay, your marker will be at 12 o'clock and you will keep the probe this way. Again, your aorta is about here, okay, and you are keeping the probe here, so you need to keep like probe slightly this angulated one, not like this way straight, so you are sending the waves downwards. So you need to be slightly this way so you can target the arch and descending aorta. Okay, there are different more views, like RV modified view, and how you are going to get the short axis view at subcostal views, and how you are going to get for example pulmonary veins, and these things you will learn by doing more practice. Okay, so this is all about the imaging. In the next vlogs I will try to show you the images where we what we see in every image. Okay, like where you see the ascending aorta, where you see the mitral valve, and these all things in the next vlog. Okay, thank you very much, and after that we will be starting our echo lessons. Please keep subscribing and share it with others. Thank you. Bye bye.